Here. Welcome to another Zoom call, getting to the end of August. I think this actually marks 7 years, I think, of doing Zoom calls. Angie could correct me if I'm wrong, but I think it's 7 years of doing Zoom calls. Um, and they're all on YouTube. I didn't do an update. I should put it on the members so that, well, let me do it at the end of the intro. Remember to look at for anybody who's new, look at your member site. Go to the member site, use the member site. I'm updating the member site. I put a whole bunch of new videos on the member site just today. Um, and look at the courses too. Um, Mainly the course that I'll be doing most of the updates on is going to be the chronic disease and autoimmune course. I think that's going to be the most relevant for our cancer patients. And then also look at the blogs. I put in a lot of videos on blogs too. And um, Grace is blogging a lot about different recipes and things. But I do want to make an announcement about, I want to make an announcement about YouTube. So YouTube is what we're using currently. I'll upload this video onto YouTube and it's listed as unlisted. So nobody can see it, nobody can find it unless you go to the member site. And on the Zoom call videos, I'm sure all of you have done that and looked at the past Zoom calls. But YouTube just passed a ruling for a new piece of their discriminative apparatus against anybody who doesn't toe the line with the general rule of thumb of what our tyrannical government is pushing. And they called it, what did they call it? The new Medical Misinformation Act, that they're going to be pulling video off of YouTube. Well, we just got another video deleted by them, which is hilarious because it really had nothing on there. It was understanding our bundles, our different supplement bundles that we have. So why their AI would pick up that. Remember, it's not a human being that's looking at our videos. It's AI that's picking up some verbiage I must have used in the video. As I said, something about breast cancer. It was probably our breast cancer bundle video. Um, and So they picked up preventing breast cancer or something like that. And they what they do is they just delete your video. And then they send me an email, one of your videos has been removed from your content. Well, I just want to warn everybody, we're working at getting basically out of YouTube. We got out of Facebook a number of years ago because of the same situation. They were looking at our data. They were, it's just very sad the way our world is coming and the way we keep speak our mind and tell people the truth about health. So YouTube is, owned by Google, and they are getting worse and worse. And I think in the next year, we're going to be completely off of YouTube. We're actually working, Dustin's working on building our own video platform. So we'll have more information on that, but I just want to let you know what's going on with YouTube. If ever I can't upload a Zoom call on to YouTube like that was a few weeks ago because they banned us for a week and we got disciplined and banned off YouTube for a week. I had to upload it directly to HubSpot. Yeah, that's the software that we use for the member site. So we'll just do that and just continue to be protected. But it is just a runaround that we're getting from the powers that be constantly. So I just want you to know what our fight is, and that would be, a good thing to pray for us for protection that way, because they're trying to get rid of practitioners like me any way they can, and they'll get rid of our information scrubbed off the internet if they could possibly do that. So we're trying to host it in protective. Our website is hosted in a protected by people in a company that believes in First Amendment rights and freedom of speech, and they're a very conservative organization that it's a very safe place to host our website. But it's just never ending. Okay, sorry, enough of that. Let's get to your questions. Question number one: what is the Rebuilder? Does it have to plug into the Rife, or is it a standalone device? Will it help all nerves and not just those negatively affected by chemo? So a Rebuilder is a standalone device. It's not made by TrueRife. This is what it looks like. It looks like a little TENS unit. It's very small. This would fit into the palm of your hand. And then the wire connects to the top up here and bifurcates into two wires, and they're little teeny pads, and they're rubber pads, and you put them in a bucket that is a split bucket, not like your Ion ProWave bucket where both your feet go in the same water. It's a split bucket, so each foot goes into a different, bucket of water. And then you put those in there, and the pads in there, you turn it up, and it's a little electric stim that goes through there and stimulates your feet. You can do it on your hands too, but then you have to have somebody obviously turn it up. And then that stimulates the nerves at 5.83 hertz and can help rebuild damaged nerves. It doesn't detoxify. So understand, the Rebuilder is not specific to nerves that are damaged by chemotherapy. It's not specific to nerves that are damaged by high blood sugar, like diabetic neuropathy. It's not specific to any nerve, but it is going to be most helpful for afferent pathways, meaning pathways that go from the skin back to the brain, meaning pathways that carry pain, pathways that carry touch, deep touch, light touch, vibration, hot and cold. Those are your afferent pathways that are carrying information from receptors in the skin, in the tissue, back to the brain. Those are the pathways that are damaged most readily when a person has diabetes and end up with neuropathy. With all forms of neuropathy, it's the afferent pathways that are damaged. So because they're more highly metabolic, they're going to uptake chemo more than other cells, and they can be destroyed by chemotherapy. Now, the Rebuilder does not detoxify, so you still have to use your Ion ProWave to help pull junk out of your body. You still have to use detox methods, nutritionally, etc. But the Rebuilder will help rebuild those pathways. We sell this in our store. We used to have a discount for patients, and then they called me and scolded me because we can't sell it in our store for less than what they sell it for. But if any of our patients want this, we give $100 off the cost to our patients, but you'd have to call in the order. Just do that, because we want to try to sell it at close to our cost as possible. So it's just that we had it that way, and then Rebuilder called us and said we have to keep a minimum pricing index on any online stuff, so we had to change it back to the price. So that is available in our store. And again, that would be for someone who has neuropathy. If you don't have any neuropathy, then you wouldn't need the Rebuilder. I was planning on sending in a cheek swab today, Monday, but Saturday was an IV started coming out, and instead today I'm at MedStat getting a steroid shot and a prescription for more. This person talking about poison ivy. I have it really bad. I assume I should wait to send the cheek swab in. How long? So given the rest of this question, this person is talking about poison ivy. Poison ivy started coming out, meaning maybe a rash from poison ivy started coming out of the skin. So how long should I wait before I do a cheek swab? Well, the poison ivy rash isn't going to affect the cheek swab for cancer, so you could still do this, send the cheek swab in for the cancer. Also, what's your recommendation for treating poison ivy? Uh, um, OTC, over the counter. I really wanted to avoid the shot, but the poison ivy is too bad this time. Don't PSA, don't pet strange dogs. You don't know what they've been into. So there's a lot of treatment things for poison ivy that you could search on the internet. I remember when we lived in the woods, we had lots of poison ivy, and uh, I got to the point where I was basically just immune to it. I could literally pick it out of my garden, and I didn't even break out. So we just got to that point. We have poison ivy up where our office is now, because our office is a house out on 12 acres. And I get exposed to poison ivy every year. I get a little bit of a rash. As long as I try not to itch it, I don't get it. It's too bad of an issue. But there's some people that end up developing IgE antibodies to poison ivy, and then they break out really bad and they get really blistered and such. But it is I think it's called uracil acid oil that is really the contaminant to poison ivy. So um, the you have to get the oil off your body. So you can't just wash the skin with water when you're exposed to poison ivy, because it won't, because oil repels water. So you have to use some sort of oil cleaner to get it off your body. So many people recommend some of the cleaners that would be used, some of the solvents that would be used as hand cleaners for like mechanics. I can't remember the name of them right now, but I used to have I think it was goop or something like that, that was in a jar I had in my garage on my workbench, so that when I got really oily skin from working with my chainsaw or something, I would grab some of that and clean off my hands. Using something like that that's oil soluble, that will help pull that out off the skin, is the best thing. Once you already get the reaction of poison ivy, there are anti-inflammatory things you could do from a nutritional standpoint, but still, it's hard to get to the skin. Obviously, most people are using the steroid creams and stuff for poison ivy, and um, that gets to be difficult. I had a patient years ago that had a company that sold poison ivy treatment stuff, but I can't remember the name of that company. They actually gave me some of the product to try. I believe I still have it somewhere. I've never had to use it. My kids have never had to use it. We don't have poison ivy in our house, even though we have 20 acres in our house. We just don't have poison ivy there. So we haven't had to use it. So they probably sell their stuff on Amazon. I would look on Amazon for a poison ivy treatment, and there's probably some good products out there. This guy swore that they started their company because them or one of their kids or something had a horrible reaction, and so they did the research and put the products together. I would try something like that. But could the steroids interfere? The question is really, could the steroids interfere with cheek swab? No, if I know that you're on steroids, I'll take that into consideration. But if you're maybe you should wait at least a week until you're off the steroids to send it in, just to be safe. I mean, if you're in a crisis mode, we can work around it, but you're not in a crisis mode. So let's wait till you're off the steroids. Give it a good 3 or 4 days off the steroids, and then do the cheek swab. Is it okay for me to use the infrared sauna while I'm on a corticosteroid for poison ivy? Um, I I would say no for a couple of reasons. Steroids are going to be anti-inflammatory. A sauna is inflammatory. That's what you're trying to do, is to create a fever state. And you're kind of going against it. Plus, number two, you will detox the steroids through the skin much quicker, and you'll get less benefit from them. Number three, you could actually spread the poison ivy around because you're going to be sweating more. So I would stay away from the sauna personally while you're on the steroids, for the reason that you detox the corticosteroids quicker. You're going to you're going to increase an inflammatory response, thereby fighting against the corticosteroids. And the simple fact that you have poison ivy, that it could spread more. What is NAC? NAC is N-acetylcysteine. Would it be good for a person who has estrogen-driven breast cancer? So N-acetylcysteine is a precursor for glutathione. So that's why would you take N-acetylcysteine? A person would take N-acetylcysteine for the purpose of increasing glutathione production in the cells. So what is glutathione? So don't confuse glutathione with glutamine. Now, the words sound the same. They are not even close to the same thing, completely different. So glutathione is the main intracellular antioxidant. So remember, we're exposed to oxidizing agents. Oxidizing agents have a purpose in our body. Remember, everything isn't all good, nor is it all bad. So you hear about oxidizing agents, oh, that's all bad. Well, it's not all bad. You need oxidizing agents to kill bacteria, to help you kill bacteria, to help kill viruses. It's good to have oxidizing agents. But once a virus gets inside the cell, it causes an oxidation that's going on and damages the cell. So you want antioxidants inside the cell. Glutathione is your main antioxidant inside of a cell. One of the issues with oxidizing agents is that we're exposed to a lot of oxidizing agents. Oxidizing agents are poisons. So poisons, toxins, heavy metals, pesticides, herbicides, all those things are oxidizing agents. They are in abundance, and they can damage cell membranes. They can damage, causing cancer. They can get inside a cell and damage the nucleus, causing cancer. They can cause death of a cell. They can damage the mitochondria. They can damage other organelles in the cell. They can wreak havoc. And people would argue that our exposure to the high level of oxidizing agents is a cause of the majority of our ill health today that our ancestors never experienced. And that is true. So our body, God created us to have an antioxidant system. The antioxidant system inside the cell, there's multiple, but the main one is the production and recycling of glutathione. Glutathione is so important that you don't burn through glutathione, you recycle glutathione. Well, cysteine is an amino acid that is essential to help recycle glutathione. So glutathione is used to break down an oxidant, and therefore it's reduced, and it needs to be recycled again in order to be reactivated to be used again. So cysteine is an important amino acid to help with glutathione production and recycling of glutathione. That's N-acetylcysteine. So should a person with cancer take N-acetylcysteine? So back to understanding glutathione. So is N-acetylcysteine an important thing to take for a person with cancer, or a person that has a lot of oxidizing agents, a person that has been exposed to a lot of toxins, person that's exposed to mold, person that has been exposed to glyphosates? Well, to me, it's one step better than taking N-acetylcysteine would be taking glutathione. The problem is, in years past, glutathione was very poorly absorbed. The forms of glutathione we had in the 80s, 90s, and early 2000s just wasn't worth really taking. You didn't absorb it. We used to have people put it in water and then nebulize it. That was better, much better absorbed. But now we have better forms of glutathione, even in a capsule form. We have good forms of glutathione. Any good supplement company will use these better forms. And even the best form of glutathione is liposomal glutathione, very well absorbed. So you're even bypassing the recycling process, you're increasing glutathione stores in cells. Glutathione is essential inside every cell and in the liver to help you detoxify poisons. Back to, should every person be taking glutathione or N-acetylcysteine? Well, it depends. If a person is doing chemotherapy, then they should not be doing glutathione or N-acetylcysteine or any glutathione or antioxidants that during at least a 48-hour window after the IV of chemotherapy, because you're now negating chemotherapy as an oxidizing agent. So it's about having that balance. But can someone who's not doing chemotherapy take glutathione? Yes. Does it mean that every person on the planet should be taking glutathione or N-acetylcysteine? Well, not necessarily. You do get it in your foods. Cysteine is an amino acid. It's in animal proteins and in plant proteins. So again, it's like you can be on overload of all the supplements that you're taking. I don't want people to have that issue either. I'm taking a couple of the supplements from Biotics Research. I understand they are no longer on the website, but we can still request them. It was my understanding that we could put a note on our order asking for these products to be added. I have done that twice without receiving it, so we need to call. Do we need to call and talk to someone to get these Biotic Research supplements? So yes, if anybody ever puts a note on an order and you don't receive what's on that note, you have to understand, that our system, our store is set up through a company called Shopify, and those notes are sometimes very difficult to see. So if you don't notice that there's this teeny little icon that on an order, it's real easy to miss. So if you didn't get anything in your order, regardless of whether you put a note or it was just missed, make sure you just call the office and we'll get that shipped out to you. I did note to Megan who asked this question, and we'll get that product out to you, if not today. Didn't already go out, we'll go tomorrow. So if you ever have any issue with a product, just call. You can't find something on the store, don't get frustrated. Just call the office and we'll help you with your order. That's what we're here for. IV vitamin C seems to have use as a non-toxic chemotherapeutic agent that can shrink tumors. That being said, there are many studies that say it doesn't work. What's your experience and understanding? Didn't Connor's Clinic do this at one time? I also understand that liposomal vitamin C can achieve IV levels of vitamin C in your bloodstream. Can this replace IV vitamin C? What's the typical protocol for IV vitamin C and or liposomal vitamin C for reducing tumor size? My town of 10,000 now has 2 IV therapy clinics. Okay, last part of the question first. Yeah, these IV therapy clinics are popping up around little towns even, so that's kind of nice. What's not nice is the cost. It still can be anywhere between $150 to $250 to do a session of IV vitamin C. First part of the question, IV vitamin C seems to have non-toxic chemotherapeutic effects, but there are many studies that say that it doesn't work. Well, I just wrote a blog just the other day and it's titled "Is Research Real or Bias Baloney?" Because if you've read my book, you realize that there's what's called publication bias. Publication bias in research, not to hound on this point of this research piece, many studies say it doesn't work, but publication bias is very real. That means, like, if a drug company is trying to get a drug passed, they will actually put a study out to dozens and dozens of places, universities, independent doctors. My sister-in-law worked for a neurologist who was literally never in her clinic, that all she did is make money running studies. And my sister-in-law just sat there and had these epileptic patients coming in. Some of them got a placebo, some of them got the drug. And then she would have to meet with them on a weekly basis, and she'd have to write down any side effect symptoms. She had to fill in this form that was produced by the drug company, and she would. That's the neurologist just made boatloads of buckles running these studies, and never even showed up at work. Nice gig, I guess, huh? And then the problem is that so the drug companies will get these, let's say 50 studies back after 6 months of running this drug study. And let's say out of the 50, let's be worst case scenario, 45 of them showed ill effects and it didn't work. Patients didn't get any better. Matter of fact, they had all these negative side effects, but 5 of them showed slight improvement. They'll only publish the best 2 studies. The rest of the 48 just don't ever get published. So in a very real sense, for medical literature, for any data, for any statistical clarification of the efficacy of a drug, those studies never happened. The only ones that happened are the 2 that got published that could have been extremely skewed because the doctor / university or whoever sent the results back wanted to continue to make money from Pfizer. So they skewed the results in their favor so that they could keep money pouring into the system. You think, oh, you're cynical. I'm not cynical. This is just the truth. So it's just what goes on. So if a drug company wanted to slander, a nutrient or vitamin C or anything like that, they'll just run a study. A number of years ago, they ran a study on vitamin E in the heart. They purposely used alpha tocopherol, which is the outermost shell of the vitamin E, which everybody knows that's not the protective part of the vitamin E. Vitamin E has 4 outer shells, tocopherols, and 4 inner tocotrienols. That's what makes up a whole food vitamin E molecule. Well, they used only that outer shell alpha tocopherol as this in the study, and it showed that people who were taking that form of vitamin E for their heart actually did worse. So then this giant study and all these articles and CNN reports said vitamin E is bad for your heart, and any nutritionist telling you to take vitamin E for your heart is a quack, and blah, 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 blah. It's just purposely skewed the study. It's unbelievable. And if you haven't been awake during the last few years of COVID, how they just absolutely just ruined the lives and careers of doctors and people that have been trying to help people with ivermectin and other natural aids for viruses, you need to open up your eyes to see what really goes on. So I'm not trying to be cynical. I'm just trying to be an honest observer of what's going on in our times. So I'm all for looking at studies, but you have to look at them with a very critical eye. That being said, I don't believe that vitamin C is going to work on everybody else. And I do believe that there's a lot of alternative things out there that are skewed in the favor of an alternative thing too. As a matter of fact, somebody asked a question down here that we'll get to in a second. This next question, it's the next question that this person is thinking about going to this clinic that says that they have documented success of 90% remissions. Boy, that would send a red flag up my flagpole right away, that they're even able to make a statement like that, even if it was true. They have to be very careful of um, these types of statements. This is what gets alternative doctors in trouble, and I think it gives us a bad name as well when you start making claims that it's just, how do you define that? It's how it's, where practice of medicine has a 5-year survival rate, and which creates rubber numbers in themselves, because if you live one day after the 5 years after diagnosis, you're considered cured, even though you might have lived a horrific life and died the day after that 5 years. So you're pushed in the list as cured, which is very skewed data. So it's really hard to truly keep data on what is a true remission, and because okay, I feel like I'm in remission, but I could have cancer growing inside me right now, and I could go into a full-blown reoccurrence at any given time. It's day by day dealing with things. So I get it. And you just want to make the best decisions, and you're trying to do your research to make the best decisions. And what should I do with IV vitamin C? And should I go to a clinic like this who's touting pretty high success rates? It's very difficult to make decisions when you're trying to deal with something that's affecting your life. Let's get back to this question. I've rambled too long. I think IV vitamin C can be very helpful, but I don't think it's a cure-all, end-all for everybody. And if it's something that you want to try, I'd say by all means try it. There really is no downside to vitamin C. So by all means, give it a try. Can you use liposomal vitamin C in lieu of IV vitamin C? Yes and no. You'd have to take a lot of liposomal vitamin C to get up to an equivalent dosage of, let's say, 75 grams of IV vitamin C. So typically, if you're going to go in for IV vitamin C, you start out at a lower dosage. And that lower dosage is, depending on your weight, maybe 15 to 20, maybe even 25 grams in your first sessions. And you slowly work up to 35, 50, and you slowly work it up to 75. I've had some people go over 100 grams of vitamin C. Now, it would be really difficult to get equivalent dosage of 175 grams of vitamin C doing liposomal. I guess it'd still be a lot less expensive, and if you don't have a place around you to go, you could still possibly do that. Dosage of liposomal vitamin C, it's typically said that 1 gram of liposomal vitamin C is equivalent to about 5 grams of IV vitamin C. I don't know. That was statistics from several years ago. I don't know if that's still thought to be true, but if you could use that type of measurement to try to figure out if you're going to get the same dosage. The benefit of doing liposomals, you could do it daily versus going in once or twice a week doing IV. And then the IV, you might get this major therapeutic benefit flush dosage, but then it has a half-life in your body and it's going to be gone. So you think, well, maybe that's better. You're getting this major flush and then it's flushing out. But maybe it would be better if you had just a little bit less dosage on a daily basis. So I think it's really worth experimenting with each person. Everybody might be different in how they respond to it. Some people might respond better to a super high dose once a week. Some people maybe a medium dose in liposomal on a daily basis. It's worth experimenting with. I'm not saying you don't look at research. I'm just saying that you look at it with a critical eye. And I think you should look at everything with a critical eye. Yeah, I just think that's the world we live in. Okay, so next question I touched on, there's a clinic in Tempe, Arizona that touts 90% remissions. Dr. Huber points out that following their protocols, patients who do not include sugar, that is, they're doing more of a keto diet, have a 90% successful in going into remission, while those who do eat sugar are at about 36%. Now, I would say that that statistic has some merit, not that you could pull those numbers completely, but I think people do better the less glucose they consume, because though not every cancer is only going to feed off of glucose, I do think that that all cells would prefer to use glucose. So cancer cells as well, they'll still use glucose. So glycolysis is the normal preferred method of production of ATP, in all cells. So if you could omit that, that is good. That being said, I think you have to be switching up your diet at different intervals in order to keep a cancer at bay. So I have been thinking of a treatment protocol has not been working as well as I would like. I think one reason has been I'm consistently cheating when it comes to sugar. Yes, I use low glycemic sugar such as monk fruit. Yeah, but while at first I go off it completely, I started having high carb meals, and then for a time added chocolates, tried to stay with dark chocolate almost every day, or non-dairy ice cream bar on occasion. While I've dropped that now, I now have blueberry muffin on occasion, but mostly with high sugar fruit or juice high sugar fruits, which I thought was okay. I hate to admit it, but it creeps up. Going to dinner with friends doesn't always help. Yeah, I know it's hard, but I do think that you know that's you can get around that somewhat by doing intermittent fasting. But still, if you're cheating, especially if your cancer is growing, you have to get super serious and strict on your diet. But even people that are on a really super strict ketogenic diet, um, for a long time, their cancer can find another fuel source. So you have to be willing to pivot pretty quick. So if it starts feeding mainly off glutamine after there's no glucose, and you've been in remission for 3 to 6 months, and now the cancer starts pivoting to feed off of amino acids, then you have to be able to pivot quickly and get out of the mindset that I can't eat any carbs. So it's it's just a balancing act. So again, I would say, try, if you feel like your cancer is growing, try to get really super serious about like a more ketogenic type diet for a period of time, see what happens, do testing and see what happens, so you can see if there is if that was a piece, just like I said with testing yourself with the vitamin C. Just make sure you're not making too many changes at the same time, so you don't know what is actually working if you're finding success. Does mangosteen juice have value in shrinking cancer tumors? Mangosteen juice, I think, mainly works as an antioxidant. So I think it can be really beneficial as far as helping you detox. I haven't seen anything with mangosteen juice with shrinking tumors, though. I started the artemisinin program today and take this by 6 to 7 a.m. daily now. I got the DMSO also. Thank you for picking that up. Hopefully that will help with some inflammatory areas too. I just wanted to make sure my coffee enema I do daily about 10 a.m. will not remove the artemisinin in my system. No, I mean, if the artemisinin is circulating in your body to go through the liver to be detoxified, yes, doing a coffee enema is going to hopefully help with the detoxification, what's going on in phase 1, phase 2 of your liver. But if the artemisinin is trying to go through that pathway, I would say, I would say go continue to do the coffee enema. From a physiological standpoint, it doesn't make sense to stop that. You're not doing artemisinin as an oxidizing agent like a chemotherapy. So where you would omit a coffee enema during chemotherapy. So I would say to change that. Out of curiosity, why are amino acids not beneficial while challenged with cancer? Do they promote cancer growth? I touch on that. Bacterial cancer is always trying to find a fuel source. So the fuel source, the most often preferred, is glucose, but then it can use methionine and glutamine, amino acids as a fuel source too. So you're trying to cut off that fuel source. So you are going to be consuming amino acids, though. You're not going to go protein free of your diet. You need amino acids are the building blocks of proteins. You need amino acids for everything in your body. That's how you make enzymes. That's how you make cell membranes. That's how you make everything in your body. So you need those building blocks. You just don't. There may be some sources that are feeding the cancer, and you want to try to eliminate those. You asked me to have a blood draw in a month. I just ordered the female tumor marker panel. I'm just wondering what all will be assessed. My memory is failing me. Well, I'd have to look at it as well, but the female tumor marker panel is testing 5 tumor markers most commonly seen with female tumors. I think it's CA-15-3, CA-19-9, CA-125, CEA, and one other one. That's different than the male tumor panel, male tumor marker panel, which would also include PSA, maybe not the 15-3. So, yeah, it's not testing for, it's not a CBC, which is a complete blood count. It's not a complete metabolic panel. So that would be different. So you'd have to order that as well if we want to look at those things. I've been measuring my glucose and it remains higher than we'd like it to be. The lowest I've been able to get it is 87. Very frustrated because I've cut out all honey, maple syrup, also tried to minimize fruit, increased meat, still doing a lot of vegetables, as much organic as possible. The only processed foods I do are occasional gluten-free better pasta. I do eat some rice for a starch. Lately, more potatoes than I should. Thanks so much. Yeah, it's people think that I'm just gonna reduce glucose out of my diet and my glucose is gonna come down. Well, anybody that has diabetes understands it's just not that simple. So reducing glucose is the start, but your cell membranes healing, how damaged are your cell membranes? How healthy is your pancreas? All this plays a role, and it takes time for those things to heal. So you just got to be patient with yourself. It's not 100% tied to your diet. My stomach still sticks out, and I can't figure out why. Well, I can figure out why mine sticks out, but that's a different story. I'm at a good weight, eat clean, take all my supplements, and many have to do with detoxification. I'm asking not because of vanity, but because I'm wondering if I'm missing a step of detoxification or something else. I know that my gut health is so important while dealing with cancer. Someone suggested it could be related to cortisol. Have you seen Dr. Mercola's new article about adding carbs back to the diet once you've resolved insulin resistance? Something he never thought he'd say. Okay, so well, I need more information than my stomach sticks up. You know, are you bloated? Is it inflammation? Is there ascites present? Is it always, or is it only after a meal? Is it, you know, there's lots of questions that need to be asked with this question um, that could lead to different things. Certainly, it's not that you're just missing a supplement. So, some major causes of abdominal bloating um, can be, you know, hidden H. pylori infections, dysbiosis, which, you know, so when you're dealing with digestion, you have to start from the top down. You know, does this person have adequate HCl production so that they're digesting proteins and carbs in their stomach in the first part of the small intestine called the duodenum? Do they have, number two, good production of pancreatic enzymes and health in the pancreas that's released? Number three, does this person have issues with their gallbladder? The major cause of bloating right there, because if you have issues with your gallbladder, that's what I call phase 4 of the detoxification process, then you're going to have issues. So that could be an issue. How do you know if you have gallbladder issues? Well, the best way to know is to get an ultrasound of the gallbladder to see if you have sludge or stones in the gallbladder. But how else could you get hints that you have gallbladder issues? Do you have issues eating when you eat fatty foods? Does it give you a little tummy ache? Some people aren't sensitive enough to know that. Some people just kind of inherently, well, I don't eat a lot of fatty foods. Well, why? Because it bothers me. So, well, there you go. That's why I hint that you have gallbladder issues. So gallbladder issues are very common. It's even more common with females over 40. That can cause that bloating issue. Those things all can lead to damaged gut epithelial layers and gut permeability issues, aka leaky gut issues, intestinal dysbiosis that can happen regardless of whether the person has cancer. It can be completely, you know, separate from a person's cancer diagnosis. It's a comorbidity, but not really completely related to anything else going on with the cancer. So very common issues that I just talked about right there. So how would you know that? How would you address that? There's certainly labs that you could run to deal with those kind of things. But you starting with, I think I have a blog post about HCl and H. pylori. That would be helpful to look at that first and follow some of those steps. As far as adding carbs back to your diet once you've resolved an insulin resistant issue, I do believe that we're not supposed to be carb free in our diet. But when we're dealing with cancer, all that kind of stuff goes out the window. We're trying not to fuel the cancer and things. So you have to get back to our previous questions when we talked about that. So it's not just about insulin resistance that we're talking about, it's that we're not trying to fuel the cancer. Okay, some questions that came in. My wife gets warm, sometimes hot at night. Is that okay? Yes, that's normal. Your bulb is going to get very hot. That's why the new bulbs have a little hole in the plastic to let that out. Is there anything you need to know about the hole in the bulb cover? Not to block it with a sheet. Well, you do your best. It will get warm, even if it's open to the air. Must I avoid whey if I'm avoiding dairy? Yes, I would not use a whey protein. If you're using whey in that form, I would use a pea protein um, uh, or something like that if you're using a protein drink. Poison ivy we talked about. Here's Dr. Huber's determined their results. A couple of times I've received free, almost expired or expired product, which is very kind of you. This happened on the order I received yesterday. The product is called Aloe Vera Entourage 2. It is a liquid with a dropper. How should I take this and what will it offer me? So whenever, if you do get a free product because it's near expiration, it's not because it's bad. All our nutrients are good for 2 to 3 years after expiration. We can't sell it once it's close to expiration, so we give them away. Aloe vera entourage is a CBD oil. So CBD is very good for a lot of things. It help decrease inflammation in the brain, thereby it helps decrease anxiety, it helps decrease pain. It attaches to the cannabinoid receptors. All your cells have cannabinoid receptors, and it works as a stimulant to detoxification and anti-inflammation. So would CBD be good for everybody to take? Sure, it's just expensive. So it's not something I recommend all the time. It's something that's used in the fenbendazole protocol. Um, and it's something that we sell a lot of because a lot of people are into CBD for they cure that it. There's a lot of misinformation out there that it cures everything, but CBD is beneficial, and there's really no downsides of CBD except the cost. A lot of people use CBD at night before they go to bed. It can help calm them and help them sleep better. Hi, Dr. Connors. Could you recommend a good digestive enzyme for me, blood type A, low HCl? So I would use our Clear Digest. Clear Digest has HCl and a complete mix of enzymes. I picked that one to private label because it's not super high in HCl, which can be an irritant as people are healing their gut, healing their stomach, if they starting off trying to heal. So I would use the Clear Digest to take that with every meal. That's our own private label. It's Clear Digest. That's a good one. I will email you the Mercola article. He talks about cancer too, even though he was suggesting the carbs. All right, great. Thank you so much. My stomach is flatter in the morning, but I haven't noticed a pattern with fatty foods. I was taking Digestime from Design for Health, but didn't seem to help. Okay, so Digestime is our Clear Digest. So Digestime, so I can't remember if I made a video about this, but I think it's in the blog post. It's really, really important. I better make a video about it because the proper way to dose hydrochloric acid in digestive enzymes is really to looking for the blog here, is really to take, okay, so let's say a person has bloating issues, and we're going to start at the top. That's what you do when you're dealing with digestion. So you start at the top and you um, uh, uh, everything. Let's see, H. Then the top is, well, of course, you're looking at whether you are able to produce saliva to be able to produce ptyalin. That's going to help break down carbohydrates in your mouth before they get to your stomach. Whether you're chewing your food, you have to chew your food in order to secrete hydrochloric acid. That's why I'm not a big fan of chewing gum a lot, because when you chew gum, you're stimulating hydrochloric acid production when you don't have food coming down there. And then once it gets to your stomach, you need to produce enough hydrochloric acid. Now, here's the blog post. Let me change my share screen here. And you can see it now. And it's Helicobacter pylori, information and care. Talks about H. pylori, what H. pylori does, and the importance of HCl. Stage 1, remove dietary antigens, testing for antigens and stuff. But starting at the top for digestion really is starting with a digestive enzyme so that you have HCl in your stomach when you have food. And I like a digestive enzyme that is also going to have a product that's also going to have digestive enzymes. But you have to dose the HCl up to the point that it's going to work. So you could say, well, I started taking one and it really didn't help. You got to dose it up. I've had people that have to take 7, 8, 9 9 of the Clear Digest or a similar product per meal for a week or two before the bloating started going down, and then you start titrating down. So you titrate up and then you titrate down. Some people, their stomach is in such bad shape, maybe possibly ulcers, that they can't even take HCl. They have to, let's say they take Clear Digest and, oh my gosh, it gave me a stomach ache when I took that Clear Digest or any HCl product in. Well, then in this article, it says, then you have to go do the apple cider vinegar test. You take 2 tablespoons of apple cider vinegar, put the HCl, the Clear Digest product away for a little bit, and you just use apple cider vinegar. If that causes burning as well, then we got to take another step backwards, and you got to heal the gut with products like Clear GI if you don't have cancer, which has got a lot of different herbs in it to help heal the gut lining, but it does have some glutamine in it, so you have to be careful of using that when you have cancer. Or you could just go with just some of those individual products that are in there, like deglycerated licorice and remember all the ingredients that are in that, and start healing the gut lining. So this would be a person, if they have burning, they definitely have an ulcer. So they have to heal that first, and then we go back to this step and we start giving a product with HCl and digestive enzymes. And then you dose it up, you titrate it up to, well, my bloating's all gone. And now you start titrating down. You don't need to stay on 4, 5, 6, 7 of these per meal for the rest of your life. You titrate down so that, eventually you don't necessarily need to take any. That's the goal. Your stomach is producing enough HCl. And I think I did make a video a number of years back, the importance of HCl. Everybody's talking about alkalizing their cancer. Well, one of the reasons why the tissues have an imbalance of acidity is because you're not making enough HCl in your stomach. How does that have to do with my lung or my liver? Well, it has everything to do with it, because the production of HCl by your pineal glands of your stomach actually gives off a base that goes into your blood and alkalizes your tissues. That's how your body works. So when you eat food and your stomach is healthy and you produce HCl and your stomach makes more HCl, then you actually alkalize your tissue. Well, one of the issues when I'm not making a lot of HCl because I have, not treated my stomach well, I've eaten a bunch of crap and it's damaged my stomach lining, so I don't make HCl very well. And then I end up with H. pylori, which decreases HCl production even more so. Then I'm not creating an alkaline substances that are going to alkalize my tissue. So I'm not creating bicarbonates that are alkalizing my tissue. So then it's a negative cycle. Now H. pylori, which is gram-positive bacteria, is created in overabundance in my stomach. It gets worse. That could actually create a gastric cancer. This is the cause solely of gastric and duodenal ulcers. This is one of the top 5 causes of cardiovascular disease and endothelial dysfunction. Very, very important to deal with the gut. Not one that says you heal the gut, you heal everything. But if you don't address the gut, you are doing that at your own risk, because it just causes all sorts of problems. So this is a good blog post. I have to actually create some videos to go on this blog post too. Oh, I did. I created a couple, but this one's an old one. But um, look at this. I'll actually create some videos that will help with that too. Um, is your cancer book no longer a free download? Um, I don't know. I think we actually changed it to be only a part of it be a free download. And the reason was we got so many complaints of people that would, my staff would say, well, download his book. It's for free. And they'd say, oh, I downloaded, it's too long. And it, blah, 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 blah. So then we actually compartmentalized it, broke it down, which you only get part of it as a free download. You could order it on our store. You could order it on Amazon, though. I missed this. I was taking 2 with lunch and 3 with dinner, tolerated them fine. My local practitioner also tested me and they didn't test me. Okay, so well, make a decision there. All right, well, we're at about that time. And so I think it's time to uh, close for the night. I thank everybody for being here. Ask that you continue to pray for us. We are continuing to pray for you. Know that we love all of you. And we thank you so much for all you do.